Watch Quiz24 without ad breaks on Wikisana and use the worldwide unique AI search query. Ask your individual health questions and benefit from exclusive programs. I would like to welcome you back to the EmpiricalMEDICINE format.
I am delighted that you have tuned in, and I would now like to invite you to my interview with Dr. Heinz Lüscher. He is a general practitioner and orthomolecular physician, and today we are talking about weight management. Successful if you can at over 50, and we are now looking at what you can do. I'm very excited because the trend in our society is very much towards obesity, and we want to see what we can do to counter this.
Geht ja sehr in die Übergewichtigkeit und dem wollen wir mal gucken, was wir entgegensetzen können.
I cordially invite you. See you soon. Dear Heinz, a very warm welcome. Nice to have you here. Today, we've chosen a heavyweight topic, weight management. But there are people who struggle with too little weight.
Too little like me.
So they are certainly outnumbered.
After all, I weigh over 50 kilos.
Good.
I'm happy with that.
Exactly. You have to feel comfortable with it.
Yes, that's true. Of course, being underweight is also a big problem. There are usually psychological problems in the background. But that's not the issue today. The issue today.
Exactly, that's right. We now want to look at what we do when it's too much. In other words, too much of a good thing, or too much of a bad thing, rather. I have the feeling that the trend that we have been observing in America for a long time is continuing in Germany. The eating habits that have been established there, always bigger, and all you can eat and whatever. And I think that's a really fatal trend. But now, let's take a look. I'm sure people with this need also come to your practice or your clinic. We have now specifically set ourselves the goal of successful weight management after 50. Why is weight management after 50 so important? Or special?
Yes, because it gets more difficult the older you get. If you're overweight at 30 and make really fundamental changes, then you have a great chance of losing weight well, and then keeping it off. After 50, it simply becomes much more difficult. That's why this restriction. These are the most difficult patients when it comes to weight loss.
Yes, and people is a creature of habit. That's probably where it starts. And they don't want to change the habits they've acquired over a long time or many decades when it comes to eating. After all, food is such a specialized topic that it can be difficult to break.
That's right. As you say, it's more difficult to change a habit after 30 years than after 10. Absolutely. And that's where also the problem, and convenience is in the foreground. Eating is so nice, and sitting still is so nice, much more comfortable than going to the gym. But, of course, that's where you would start. And without a really life-changing way, I can't help people.
It starts with inventing things so that I can switch on my TV at home from the couch or switch on my light or the heating so that I no longer have to get up. So that alone, I don't have it now, but I think that alone is just so weird that you can't even move around. And that's so typical for our society. I don't want to lump it all together. Of course, there are also those who exercise diligently, but they are probably in the minority.
Yes, that's clear, the minority.
Yes, so that's also something you observe in patients who come to you with obesity, that they have too little exercise across the board.
Yes, absolutely. But they've been doing it their whole lives, not just for a short time. In some cases, because of a lack of time. I can see for myself how difficult it is. I go to the gym once a week and try to hike or walk for at least 3 hours. That doesn't always work. But I realize that if I haven't done anything for 2 or 3 weeks, I don't feel the same. But I have to overcome myself, just like everyone else. Once I'm there, it's fun, but going there fresh. And that's the point, this self-discipline and overcoming comfort. You can't do it without that. And I also have to tell my patients, you have to make a decision, maybe even put it in writing, what new thing I'm going to do, and hang it up somewhere on the fridge, and so on. That's the prerequisite. If you just say, yes, I'd like to lose weight, I won't eat dessert tomorrow, and see if it works, then you don't have to start at all. Without a decision. It makes no difference whether I want to stop smoking, alcohol, whatever. It makes no difference. If I want to lose weight, I have to make a decision, and it has to be followed through.
I once heard that obesity, or these fat cells, can be created very early in childhood. If a child is already overweight, then the chances of getting rid of this excess weight in adulthood are very low.
Yes. So if someone is really seriously overweight at the age of 50 and it started in childhood, then it's close to impossible. That's true. Because these fat cells were there early on. If an overweight child now realizes at 20 that there's something wrong with me, they have a chance, but only with total consistency.
What do you think of the things that are possible with gastric banding and stomach reduction and things like that?
That's not the first thing. It doesn't make sense if you haven't changed your lifestyle beforehand. Just inserting a gastric band and then continuing to live as before is absolutely pointless.
Because then you can probably expand the stomach again, I think.
So the gastric band no longer exists. You can have a stomach reduction. But that is a major operation. So yes, it can be outwitted. I also have patients who have had this and are still the same weight.
Okay, when you say lifestyle, we've already mentioned exercise. Diet is probably an important factor.
Of course, that's number one. So people overestimate exercise. Yes, I eat like I always do, but then I go for a 10-minute walk around the house in the evening. That's ridiculous. I like to give an example. If you walk up a steep hill like that for an hour, you need an extra 600 calories, which are then burnt. Imagine, that's a bar of chocolate. That's all you need to walk uphill for an hour. So the calorific value of exercise is much lower than people think. So we have to start with nutrition.
And then there was, or there always is, this FDH story. I'm not saying devour half, I'm saying eat half. That would be a good step for many people if we could keep it that way.
It's going in the right direction, yes. But you still have to look at a few details. Every time I eat carbohydrates, I release insulin. And insulin then floats around in the blood and helps to metabolize this glucose. Whether I've eaten pasta, bread, or sweets, I have glucose in my blood. And the glucose can only be transported into the cells with the help of insulin and a few enzymes. However, insulin has the disadvantage that it blocks the fat cells. This means that fat cells cannot be emptied or reduced in size as long as insulin is in the blood. If you keep eating carbohydrates throughout the day, you will have a permanent insulin level that is too high. This then has a long-term effect on diabetes, but also in the inability to lose weight. So the first thing we have to reduce if we are overweight is carbohydrates. That is massive, but we need carbohydrates. There is the so-called ketogenic diet, which would be carbohydrate-free, but many people can't stand that. Then I say, well, let's stick to carbohydrates, but then whole meal products, and only in the morning and at lunchtime. So it's crucial. No more carbohydrates after 5 p.m., but zero. Not even an apple. You've got fructose in there. So dinner is no pasta, bread, potatoes, rice, nothing.
Also Abendessen gibt es keine Nudeln, Brot, Kartoffeln, Reis, nix.
Just salad, vegetables, maybe an egg, a bit of meat, cheese, that's fine, but nothing on top. Then we have no insulin secretion, and now it is possible to lose a little weight at night during sleep. Because if there is no insulin, the fat cells can be relieved.
Wenn das Insulin fehlt, können die Fettzellen entlastet werden.
So we have nutrition, we have exercise, we have lifestyle, everything is included in the normal case. Do you have a restriction? No.
Yes, for many people, it's a huge restriction to eat less and exercise more. For many, it's a total overload. Especially if, let's say, you're 120 kilos and I say you need to move more. I'm aware of what that means. I carry my 50 kilos around, but if someone puts 120 kilos on their knees and feet, that's an incredible load, and they can't just go hiking for 2 hours. So you have to start very carefully. In Zurich, a group of students tested how overweight people feel. They have these pregnant bellies for Hollywood and feel like they're 30 or 40 kilos.
Yes, or there are fat suits like that.
They could barely walk around the city for an hour. They had to sit down. They were so tired. That's how an overweight person feels. People of normal weight underestimate the fact that these people actually make a lot of effort. But if we don't stop the source of the excess weight, then this effort won't help us lose weight.
When you say, don't stop the source, where do you see the source? So apart from diet and exercise?
No, that's the source, the malnutrition, the overeating. We all eat too much.
Because in many cases there is also something psychological behind it, some problematic childhood experiences. But we're now at the stage of weight management after 50, where this develops.
Exactly, you're right. When people are mentally unwell, eating is a form of reward, a form of self-care. This is sometimes difficult to stop. So if someone also has mental health problems, that's not an ideal time to lose weight. But I think we would rather leave the issue to one side now. I think it's even more important to point out that the gut function, also plays a major role. Sleep, insulin, and progesterone can also play a role. So hormones also have an influence where we can intervene. But I always have to tell patients, look, we can provide a little support here and there. But without this discipline, which we have now discussed, it simply won't work.
Yes, that's right. Because at the end of the day, the situation has somehow arisen because of what the behavior was like before, what the lifestyle was like before, and so on and so forth. And that's why it should be logical for everyone to want to change something if they want to see different results. So you say intestinal disorders, which means that you accompany people after a corresponding examination, which is then backed up with laboratory values to ensure that the intestines are put in order.
Yes, this is a prerequisite for being able to absorb micronutrients, because obesity is always associated with a metabolic problem, the so-called metabolic syndrome. This is high sugar, high cholesterol, high blood pressure, and obesity. They go together, and this only develops over many years, and a sick gut supports this. Because if we have an irritable bowel syndrome, a leaky gut syndrome, the micronutrients are not absorbed well enough, and without the micronutrients, the metabolism is disturbed. So this connection is, people are not sufficiently aware of this connection. So a healthy gut, now you can assume yes, then it absorbs everything all the better. Yes, but it absorbs the healthy substances. It absorbs the carbohydrates anyway. But we also need the micronutrients so that the metabolism works better, energy is increased, and so that not all excess calories are converted into fat but are burnt in the body. That's why a healthy gut is important.
Are there somehow, because you are a kind of molecular expert, are there special vital substances that are conspicuous in someone who is overweight, which are definitely missing there, also to improve the metabolism accordingly?
No, you can't look back at one or two vital substances. There are diseases where the same vital substances are always missing. For example, with ADHD, we know that hormones, iron, and magnesium are missing. But with obesity, the whole metabolism is somehow simply not normal or balanced. A lot of things are really missing. If you measure laboratory values, then the minerals, proteins, amino acids are not ideal. The fatty acids are not ideal. So almost everything is somehow out of balance. That's why weight management is difficult.
But it is possible, in principle.
Yes, it is possible. If the patient cooperates. I have wonderful examples. I once had a man who was of course even younger, about 25, who came in weighing 125 kilos. He could barely get in the door. He was as wide as the opening. I thought, my goodness, what am I going to do with him? He understood. I've never experienced such a discipline like that again. We had the goal of lose 25 kilos in a year. He managed over 50 kilos in 1 year. Unbelievable. It works. But he was iron-willed. He weighed his food. In the end, 50 grams of pasta and the bread. Then he got on his bike and cycled for 2 hours. That's how it goes, but without the will. If someone wants to eat over 100 kilos and lose weight, they have to tell me how heavy they are every month. We always set a goal. We discuss the goal, and that is the patient has to agree. I don't say, by Christmas you'll be 20 kilos lighter. I ask, what do you have in mind? Or what do you think you can achieve? If someone says 5 kilos in a year, then I say that's okay for me. It's better than nothing. But I would like to have feedback every month on how heavy you are. Just the number. You don't have to write a sentence about it. It takes an average of 3 months until I get feedback. After that, I hear nothing more. That shows me how quickly people give up. Or those who hold out longer, maybe a year. Then after a month, they say I've gone from 120 to 117. I then only write back briefly. Bravo, keep it up. Another month, 116. Another month, it was my birthday, and I'm now 117 again. We can spin it any way we like. We're back to discipline.
Yes, or the one or other viewer will think so, with what is not resolved in the background, in the psyche. But that's not our construction site. But that would still be the aspect that perhaps many people depend on.
Of course.
Or boycotts the whole thing.
But if someone is suffering from depression or has huge problems right now, that's not the ideal time for weight management. I would postpone it then.
Yes, but then he's in good hands with you, because then he'll be supported with his depression, with micronutrients, for example.
Yes, of course. But that's then a completely different topic. But to lose weight, you should be in a good phase of life. Where psychological problems are in the foreground.
But that's how I feel now because I've already seen 1 or 2 programs on American television about my life at 300 kilos. And these patients are all sent for psychological counseling, and they report that they have a broken home. Broken in the sense that they have been beaten or sexually abused, or parents not there at all, and so on and so forth. That was probably always the basis or the reason why they ended up eating for the rest of their lives. That's all I was getting at.
Yes, you're right about that. But that's not the case for everyone. Not everyone who is overweight had a difficult childhood. Most of the time, it's simply, have to say, the parents' mistakes. Obesity is not hereditary, but the habit of setting the family table is inherited. And look, if you see 5-year-old children who are overweight, at least one of their parents looks like that too. I've seen mothers with newborn babies who already had, they say, biscuits in their mouths. From morning to night. These children are already so pumped up at 1-year-old. So you can do a lot of things wrong as a parent in early childhood. And that's where it starts. My advice to all parents is not to give your children sweets until they start kindergarten. They don't need to know that. Give them apples and carrots and things like that as a snack, but no chocolate or biscuits. They don't miss that because they don't know it. And then they come into contact with it in kindergarten, but by then their bodies are already healthy and not overweight. And then it's much less.
Okay, now let's come back to successful weight management after 50. So if someone comes to you, there is a chance that you can achieve success here.
There is a chance, but
it just needs...
Unfortunately, the experience is not so good. There are individual cases that go through with it. The others give up very early. Usually, after 2 or 3 months, these patients fall back into their old habits. They miss their pasta or whatever.
Yes, I understand.
I understand that. I like that too. Everything we like as humans, that's exactly what they have to do without. And that's difficult for a lot of people.
Yes.
I do it myself all the time. Once a year I do myself for a few weeks. I force myself to live sugar-free, for example. I know how hard it is. I've already caught myself going to the box and looking for biscuits, even though I knew there weren't any in there. The urge for sweets can be so strong. But that also shows that sugar is a drug.
Yes, an addictive substance.
And overcoming that only possible with an iron will. I'm sorry. I would like a simple solution here. The simple ones already exist, but...
Exactly. That's what I wanted to talk about now. When the other end of the spectrum, Ozempic or Wegovy is what they're called, makes a good impression on the people who use it, although not on everyone, because it also has side effects such as nausea, I think. And what do you think of it?
Yes, should I say it directly?
Yes.
Nothing at all.
Okay.
It's a fashionable drug. The whole world is clamoring for these Ozempic injections. You lose weight, yes. Quickly and briefly. You really do lose a few kilos quickly. But the nausea as a side effect, the long-term side effects, we don't even know yet. So we are also interfering the metabolism again. It is an unnatural substance for the body. I would never recommend it to anyone myself.
Ja, ich würde es selber nie jemandem
But of course, there are
empfehlen,
thousands of
es
patients who
sind
want it now, because it is also described in the media as being very successful.
wird auch in den Medien natürlich als sehr erfolgreich
And it is.
beschrieben, und das ist es auch. Aber
But
der
the price would
Preis
be
wäre
too
mir
high for me
persönlich zu hoch,
personally.
aber das muss jeder
But
selber
everyone has to know that for themselves.
Of course, yes. So, what we keep in mind towards the end of the conversation, unfortunately, we're already through half an hour. What we keep in mind is that it is possible to manage your weight successfully. But it takes an iron will, iron discipline, and then you can make a change. Humans are creatures of habit. We all know that humans are creatures of habit, but habits can also be changed. And like someone who stops smoking, it's probably also possible. Although I'm making easy, and you might be making it easy too. We haven't had this problem yet. And then someone who is affected in front of the television will say, yes, you're just talking. You have no idea how I feel.
Yes, I often hear patients say that I've already done all this and it hasn't helped. I have my doubts about that,
habe da so meine Zweifel.
because ultimately our organism is also a scale.
Ist unser Organismus auch eine Waage.
So if I don't put anything on the scales,
Wenn ich auf
my
eine
weight will go
Waage
down.
nichts drauf tue, dann sinkt doch das Gewicht ab.
And it is somehow biologically or physically impossible not to lose weight if we cut back on the income side.
Abnimmt, wenn wir auf der Einnahmenseite zurückfahren.
But it can be very difficult, that's
Es
true.
kann sehr schwierig sein, das stimmt. Aber
But I can more or less only
ich kann dann
provide
mehr oder
support
weniger
and
bei diesem
advice
Thema
on
nur
this topic.
begleitend, beratend zur Seite stehen.
There are no
Aber es gibt
miracle
keine
cures.
Wundermittel.
Yes, what definitely makes sense, I assume, is to simply have your metabolism checked if you are affected.
Yes, metabolism is number one. The hormone imbalance can also lead to this. Progesterone, for example, is also a metabolic hormone. If this is missing, the metabolism is slowed down. Thyroid, it's all part of it.
Yes, that's right.
But these are just side issues.
Yes, but as I said, it's definitely an important part where anyone who is affected can simply do something good or something valuable for themselves. Where are you based?
We are in Winterthur, a beautiful city in eastern Switzerland. Wise Medicine is our clinic.
Yes, okay. Then I say thank you very much. We now have no, how shall I put it, no one-size-fits-all solution to offer.
Not a world first.
No Ozempic in good shape. Now we are once again advertising for such things, but there are others, exactly. So we don't have a miracle pill against it, but it's the responsibility of the individual to take care of themselves. I think we can hold on to that. Thank you for this moment. I look forward to other conversations on other topics. Until then, bye. All the best, dear viewers. And thank you very much for being part of our conversation. Yes, you see, being overweight is difficult once it's there. That's why the best way to deal with it right away is to make changes. Because the longer you wait, it won't get better if you don't change the situation. So in that sense, stay mindful, alert, and loving towards yourself and the world. And be sure to come back next time to see us again.